ಇಲ್ಲ ಓಕೆ ಅಲ್ಲ ಅದೊಂದು ಕೊಟ್ಟದೆ ಬಿಡು ಒಂದು ಕೊಟ್ಟು
aku tahu বলছি আমি আপনি যে ফ্যান টিভি বলছেন তাই নিচ্ছেন এখন তারপর সেগুলো তখন দেবো। আচ্ছা
Well, good afternoon, ladies and gentlemen. I hope my voice is audible.
Absolutely.
Okay, okay. So, it's in fact an honor to be amongst some of the stalwarts of Indian hospitality industry and amongst you all in this webinar being organized by Department of Hotel Management, AMC College, Bengaluru. We are overwhelmed by the response we have received for the webinar with more than 25 colleges, representatives from top hospitality chains and hospitality professionals registering from across the globe. The hospitality industry in India accounts for close to 19 lakh crores of yearly revenue, which is 10% of the Indian GDP. It also accounts for 46 million jobs, or roughly 9% of the employment sector in India. I welcome you all today to the webinar on the impact of COVID-19 on the hospitality industry. In our panel today, we have a person who is responsible for managing the pan-India revenues for Sterling Holiday and Resorts, and an executive chef who has worked with the top hospitality chains in India and has been in the industry for the past 25 years. First, I request our director, Professor Rajesh Kumar, to address the webinar. I would request sir to unmute yourself, please. Yes,
Yeah.
sir.
Okay. Am I audible now, Abhijit?
Yes, sir.
Thank you. So for the topic for today's seminar, the impact of COVID-19 on hospitality India, we are here to discuss the future of hotel and food business in post-pandemic era. COVID-19 pandemic of hotel and food service is out to stay here for some time more. And the future of hotel operation is now going to be focused mainly on health and safety, which will translate into hygiene and sanitation issues. The key to provide physical evidence, we need to also project ourselves that we are really into it so that we can give the confidence to our guests. The key is to provide a good food menu so that we now it is very difficult to produce a lavishness in the food preparation and presentation and display, because most of the time 95% of the revenue might be coming from accommodation. So in-house dining and fine dining mostly it will be passing at this point of time now, but accommodation is going to play a very major role. The corporate traveler will definitely enhance and revive some point of business in chain hotels, and communication is going to be a very key factor here. We need to communicate with our regular guests and guests who are always with us at this point of time. How do we upscale? How do we define our strategies to deal with this? We need to be upskilling ourselves, and we have to be multi-skilling so that we can face this situation accordingly. The COVID-19 pandemic has prompted a lot of change in hotel operations that could alter every time we see it. From the guest check-in to how the rooms are getting cleaned, people are there to watch. So once the stay at home orders and global bans are lifted, the industry cannot simply return to back to its normal. The true challenge is when we strike a correct balance between the competing operational factors which we can always understand. And in other words, the new normal. First point I would like to talk about is maximum occupancy versus personal space. Now, maximum occupancy, we used to talk about how we can gain the maximum occupancy and gain maximum profit. But today, according to situation, how much we are going to give them the personal space that matters. In hotels, especially, occupancy space is a thing which we are talking about. In airlines, greater personal space we are talking about. And in the restaurant, we have to understand that it cannot be the way it was before. It is to be individually plated. So these are the maximum occupancy versus the personal space. Second point, sustainability versus sanitized. Now, post-COVID, travelers will always look for cleanliness to the topmost quality, what welcome kit you are giving them, and of course, the air quality. All these things which is going to be the highest order, and that is what the guest is going to look at. And the third point is in-persons versus virtual. Here, technology will play a very, very important role, because without technology, we cannot do anything about it. And we need to upgrade our technology, because survival is because of that. So technology will play a very important role in this particular situation. Now, security was always there. We always now will talk about the safety of the guest. We talk about how the guest, we have to ensure their safety so that, they feel safe that they have come all over and they are very safe in a place. That is the fourth point. And the fifth and the last point is we cannot go for over tourism at this point of time. And we have to do preservation concept of at this point. We need to preserve what we have right now. We know the situation is not very conducive for elaborate thinking. Therefore, we have to understand the situation, how it works, and accordingly, we need to plan ourselves at this point of time. We know that the entire industry, be it aviation, be it hospitality, be it travel, it is definitely in a lower side. So at this point of time, I would like to tell you that even this year 2020, this particular year is really difficult, but we need to keep our businesses afloat. We need to keep ourselves alive, and we need to understand that we have no other thing but to keep things under our control. And we need to control that. How do we control that? We need to control our mind. We need to control ourselves. And this is what we have to do at this point of time. So I would like to thank all of you, my students, my faculties, the participants who have come, and mostly my dear friend Mr. Suraj and Mr. Brajesh Thakur and many other people who have joined in from the industry, which I know a lot of people who have already joined in. So I thank each and everyone, and we appreciate their time at this point of hour. Thank you so much. Over to you, Mr. Abhijit. Thank you.
Yes, thank you, sir. Thank you so much, sir, for the very crisp and apt welcome address. Now, let me introduce you all to our panelist for today's webinar. We have Mr. Suraj Hassan, who has been in the industry for 24 years across various industries, including hospitality, telecom, real estate, and property management. Currently, he is with Sterling Holiday Resorts Limited, the pioneers in vacation ownership in India. And the company today has 40 plus resorts across India, catering to both FITs and members. Suraj is Vice President Revenue and Management and Customer Engagement for the Sterling Group. He has vast experience in service delivery, designing across multiple organizations, and has in-depth knowledge on customer behavior. He leads the strategic vision and tactical approach of revenue management and analytics team, including the disciplines of pricing, planning, forecasting, rate management to drive revenue, profits across the resorts of Sterling. He is a self-taught techie and sought after for his go-to approach for complex processes of digitization projects. When not in office, you will find him road tripping and exploring some new destinations, and his Facebook is a proof of his love for travel and taking the least traveled roads. Good morning, Suraj. It is absolutely a pleasure and honor to have you in our panel. Yeah, okay. Thanks, Suraj. Our next panelist, yes, sir. We are able to hear you now.
Thanks, Abhijit. Thanks for the introduction. Pleasure to be along with you all and share some of the thoughts and also learn from you all how things are moving around.
Thanks, Suraj. Our next panelist for today is Chef Brajesh Thakur. He is Executive Chef at Quality Hotel DV Manor in Vijayawada. Chef Brajesh has a career spanning 25 years in the hospitality industry. After completing his bachelor's degree in hotel management in the year 1996, he worked with hospitality chains like the Taj, Welcome Group, the Oberoi, and Asia Group. Since 1999, he has been associated with Hotel Quality DV Manor, a Choice Hotels International group in Vijayawada. He is the executive chef there. So we will have the two panelists joining with us today. Firstly, I would request Mr. Suraj to share his views on the topic impact of COVID-19 on the hospitality industry. Over to you, Suraj.
Thanks, Abhijit. Thanks, Rajesh. Good afternoon, everybody. Pleasure to be here. And thanks for the opportunity for sharing some of the insights into where we are today. While as an industry or as in general, this is something new for all of us. We haven't gone through this kind of phase in our careers or in life earlier. So much of uncertainty, so much of lack of clarity. And the fact of the matter is the past trends do not really matter now because it is a new beginning. It's a new normal. And in fact, whatever happened pre-COVID, it really doesn't give you any indication of what business is in store for you as things come. So that's where we are today. As an industry, yes, hospitality industry is a very dynamic industry with multiple array of job opportunities that has been in the industry. And a great scope for people for aspiring to make a career in this field. However, the ongoing pandemic has surely hit us hard and got many industries, including us, into a standstill right now. Where we stand today, from what it was 2 months back to today in the month of July, at least what I can say, looking at the trends from various channels that come through the bookings, that is basically the online travel agencies or the offline travel trade people, or even corporate houses. What we're seeing is some green shots that's coming in. There is some moment of travel that is taking place, not to the extent of what it used to be pre-COVID, but people are looking forward for travel. Some trends that we notice, especially because we are in the hospital, in the leisure business side of it, not in the city hotels. All our properties are drive-to destinations from major source markets. When I say source markets, be it any of the tier metros or tier 1 or tier 2 cities, we are very close by, within 4 to 5 hours of drive from these destinations. The trend that we are observing is people are more open for exploring destinations which is close home. That means they're more keen to travel using their own car, not really wanting to experiment getting into cabs or taking a flight or a bus or a train. They're more open to drive it down within the secure space of their car to a drive to destinations where they would like to spend maximum 2 to 3 nights. No more, we are seeing a trend of 1 night holidays. People have now moved up to, anyway, I'm taking a holiday, let me take it to minimum 2 or 3 nights. That's the trend that people are moving into. However, a lot of factors there are a lot of factors that's influencing their travel. One, most of them are looking for, where do I stay? Because when they're traveling with families. I'm referring to leisure space right now. There are a lot of travel that's happening also in the corporate segment. There is a need-based travel because of the business needs. So cities, what I hear from my colleagues in the online travel space, that is online travel agencies that are there, like the Make My Trips, Booking.coms and Expedias, there is movement happening into major cities, that is into Bangalore, into Pune, Jaipur, etc. There's a lot of travel happening. Most of them are corporate clients which are traveling because of the need base. So there are city hotels that are catering to them. Leisure is slowly moving into these destinations which are drive to. I'll give you an example. We have opened, out of all our resorts in 40, we right now opened only 11. The reason why it is 11 is because we have challenges in opening resorts in some of the states. Example, Tamil Nadu, state government has given a restriction still till July 31st, we cannot open resorts. However, that's not the case in Orissa or Kerala or Karnataka. Government has allowed you to travel. So we are seeing within state travel, which is actually increasing. So that the risk of not having to travel in another state, requirement of e-passes, which is still there today, requirement of quarantine in some of the states that is required even if you're a tourist, is actually hampering people from traveling right now. So within state travel, intra-district travel is on the rise. You will find people from Karnataka traveling to locations like Coorg, Bandipur, Chikmagalur, etc. At short notices right now. The planning of holidays is no more, which is to be 14 to 15 days. It has now come down to well within 7 days. People plan to take a holiday within 7 days. The criteria they are right now looking at is, of course, like Mr. Rajesh mentioned, there's a lot of emphasis on safety and hygiene. Like all hotels, everybody is now, all hotels at large has actually gotten into their own hygiene and sanitation programs. At our level, we've got something called Sterling Cares, which is a comprehensive hygiene and sanitation program wherein we are looking at social distancing, contactless services related to check-ins, related to room service, related to activities. Because the holiday space, there's a lot of activities that happen in the hotel, in the resorts. We're trying to give these activities with minimum contact. That means looking at things where you have a social distancing which is maintained, and look at groups, small groups for any hike or trekking that we are going to take them to, or any activity well within the resort will be constrained to only the families groups together. Yes, there are challenges. That is like you cannot open your swimming pool because of the laws which is there. So some of the activities are restricted in the hotels and resorts right now, but there is always an opportunity for people for looking for a different scene. We've been all locked up at home for the last 3 to 4 months, seeing the same scenario of scenes from our balconies or windows when you look out. There is an urge that people want to travel. So when we did a survey within, we are in a mixed model. Sterling Holidays is in a mixed model where we do have members. We have a 1 lakh plus member base, which is our loyal customers to us who frequently holiday with us, plus our FIT business. So when we did a dipstick survey with our members, 70% of them said that they are keen to holiday again. It's a matter of time. So there is that urge to travel. There are people already looking at travel. It's the factors that is really considering a hotel selection is one. They're looking at hygiene and sanitation as one of the critical element in looking at a travel. Two, they're also looking at value deals. I don't think price cutting or price war is the game today. People are not looking at cheap hotels. People are looking at where I can find better value for money what I pay. Even if I pay a premium, is the place safe? Can I ensure that my family is safe? Can I get additional value that I'm looking at? So when you see value, most are looking at either, as an example, is a meal upgrade. That means having purchased a CP plan or a bed and breakfast plan, our hotels giving me an upgrade on meal with an additional meals added to it. It could be an upgrade of room category. Having booked a standard category, do I get an upgrade to a next category of rooms? It could be related to early check-in and check-out, because anyway, most hotels are not doing 100% occupancy. There is rooms available. Do you allow them the permission to check in early in case he wants and check out late if he wants by 3 to 4 hours in a day? These are some of the elements people are looking at. Also, our go-to-market strategies, we've been closely monitoring what's happening in the markets. The resorts that we are opening are directly linked to the source markets from where the business comes from. As I said, the drive-to destinations are more demand. So when we are opening our resorts in the phased manner, we are actually looking at source market, how the source markets are behaving, and based on that, opening the resorts to the location. Maybe the resort is in a green zone, but a source market, if it's in a red zone and people are not allowed to travel out of that particular city or town, no point opening a hotel there, because you are only going to incur your operating expenses, which is going to go up. So one of the strategies that is applied is looking at your source market, how your source market is behaving, and accordingly open your room inventory not to the full, keep on a phased manner opening that's been actually considered. So while we have, let's say 100 rooms in a property, we go in a phased manner, start off with 35 to start with. Based on demand, keep increasing the number of rooms available. Hence, your resource management is also done the same way. We are looking at sourcing the basic ingredients locally, and there's a lot of demand which is coming in from customers are local delicacies, because sourcing stuff from other cities is becoming difficult, especially like destinations that we are in. These are all hill stations across the country that we have. So sourcing from the local market, so that is giving more employment and opportunities in the local market. Getting more local people to actually come work so that the travel is not a concern. So there's more employment being provided in the local markets that's there. And hygiene factors as completely followed. Now, if you ask me hygiene and sanitation, yes, across everybody, with no exception, every hotel is following particular hygiene and sanitation standards, which is compliant to WHO or FSSAI. Everybody is doing it. Now, how do you saying that because of the uncertainty in the future that everybody is going through, you and me are uncertain when we can take on a holiday. If I take a holiday or if I book a hotel, do I really get a chance to travel because of these change in or the fluidity of the state norms that is there across? Sometimes suddenly a lockdown comes in, sometimes your zone becomes a red zone due to which you are restricted to travel. Or your en route becomes, a town becomes a red zone due to which the travel is actually postponed or is banned. We came up with a novel idea. All hotels cover something called general insurance. That means anything happening in the hotel, any hazard is covered. We felt that this is the right time to come and cover our own guests. So one thing unique that's done, and there's nobody in the industry which has done so far. Sterling is the first one to take that leap. We have actually provided something called a holiday insurance to all our guests. So all our guests has an option to opt in for holiday insurance. It's a free of cost insurance that's been paid. The premium is paid by Sterling. Wherein in case of any uncertainty in the future, if there's a last minute cancellation of his flight, his travel, or any personal accident that takes place, or any theft of his belongings, or any of these aspects are actually covered during the holiday insurance that he's availed through Sterling. So he gets his insurance cover and there is no worry of him not getting his money back in case of a last minute cancellation. Or let's say before travel, there is some hospitalization that takes place within my family. And most hotels or flights don't really cover that. At least the insurance covers it, he gets the money back through the insurance cover up to a particular value, which is insured for. That's something different that we have gone in. We've got a good response from people who are traveling. They're confident saying that at least any uncertainty in any travel ban is getting covered by the hotel, and they get their money back in some form or the other. We are also looking at packages. Okay, we just can't go only with the normal rates that we have. When I say normal rates, everybody is into best available rates that's there in the system. While we can't get into a rate war of discounting, one of the best routes that we've taken is looking at creating various products out of the holiday industry and get them on board in other new channels, explore new channels of sale. If you ask which are our major channels today, is that OTAs are the major channels, most of them depend. We have a direct channel that is your own website, you have a direct sales team, and you have your offline travel agents and corporate houses. These are the major channels every hotel actually looks forward for business. Can you explore other channels of avenue for business are being explored? We are loading up our packages into these platforms. It could be somebody who is into travel and tourism domain. It could be somebody who is actually into e-commerce. So we're getting value-added packages getting loaded into these platforms and bundling it with other products so that people get a value for money when they do a bundled product purchase. Small things are making differences across in the way people are looking at it. And one thing we've learned is keep emphasizing the safety and hygiene standards that you follow, because that's the most critical element that we are noticing today. People are really concerned on travel. There's worry everywhere. Of course, you and me would think twice before actually planning a holiday out with the family. That's a worry for everybody. The assurance of having an enjoyable holiday with safety, well taken care, and emphasized on regular basis through social media, through EDMs, through communications, is actually helping people to get that confidence and that, yes, it's time to travel again. While we're getting reservations, it was a zero reservation point when it was April, May kind of thing. June, things have started looking up. July is looking much more positive. While towards the month of July, August, we are getting bookings, but a lot of people are booking from August, September, October downward. So they have already planning ahead. Few are planning right now, and most of the bookings that is happening right now are coming from source markets of the close by drive to destination. They're all driving down, and they are clubbing their holidays along with either their friends or relatives, because they've been away from these people for the last 3 months lockdown. So they're clubbing together, taking a combined holiday into these places for a break of 2 to 3 nights and have fun there. That's the trend we are seeing. Hopefully that will continue as long as we are able to deliver that kind of promise of an enjoyable vacation, which is safe for their being. Steps that's been taken in this times is largely, yes, as I said, social distancing. That means you are looking at a minimum contact check-in. We are sending in reg card so that before he arrives itself, he can actually do his pre-registration. He can send his KYC details, which is required. So the hotel, he does not have to spend much time in the front office. Looking at buffets, there's a lot of debate around buffets about when you have a buffet, there's a chance that it's not hygienic. Because a lot of people coming in contact with food. We have actually gotten a mini buffet concepts wherein we have actually got the buffet chefing dishes manned by people, so that not many people are actually using this chefing dish. It is being served by somebody else. Looking at small a la carte packages, and the complete paradigm shift in the form of in-room dining. In-room dining is, we are now looking at takeaways. That means people can actually pick up food from the restaurant or from the F&B counter, which is with disposable plates and disposable cutlery, crockery. They can dine in their own rooms, picking up food from here. Being in the holiday space earlier, pre-COVID, what we used to notice is people, at least one meal they used to have it outside the hotel or the resort. That means breakfast at the resort, lunch they normally go out, try some local cuisine in some of the restaurants, and dinner they're back in the hotels. The trend is slightly changing. People are more confident in eating in the hotel rather than dining out. It's primarily because of the fear or the aspect of safety and hygiene that they're worried when they eat out in some other places. At least in the hotel, they know that things are taken care. So the number of meal dine-ins have increased from whoever is traveling right now, which is a good concept. We've also looked at mini meals, and we revised the entire menu to ensure we take care of single meals rather than combined meals options. These are some things that we are changing. Of course, what's more important as we go by, because most of them from the hotel industry, some of them are students in colleges here, there is a lot of emphasis getting into revenue management. Yes, I also did my hotel management. Those days, revenue management was never part of the hospitality industry norm. We had our F&B, we had front office, housekeeping, major subjects with these. So-called revenue management was not there. I'm not sure it's still introduced today, but revenue management has become a critical element every hotels, because revenue management becomes a critical aspect of your forecast, your budget, your cash flows, and what is driving your RevPAR in hotels. So a lot of emphasis is getting into that aspect in every hotel. Revenue management department is looked upon for giving information to the management for taking the right decisions for the future. Looking at rate parity across comp sets, looking at rate designing depending on what the market demand is. All these are things that's been taken care by the revenue management team. There is a lot of scope in that area, analytics and revenue management. I'm not saying there's no scope in other operational functions. Definitely there is scope. That's the backbone of the industry that we are in. I'm saying there is an additional scope that's coming in and focus coming on the revenue management, budgeting and forecasting aspects of the hotels largely, which works along with the sales function in the team. That's one major change we are noticing in these. And as Mr. Rajesh mentioned, emphasis on technology. We believed in this industry that personal touch is very critical, and we still continue to believe, because that's a difference that we create between us and an e-commerce platform. There is always a personal touch and a warmth whenever somebody steps into the hotels or resorts across. While we will continue to do that, there is a mask that covers your face. Your smile is being covered right now. Other aspects of the physical, your body language Your sign languages are giving more emphasis of what you would like to express. So there is that focus coming in. Technology from all aspects of going digital. If you're talking about the menu card is now moved on to QR codes. Nobody is giving physical menu cards. You scan a QR code, you get the entire menu onto your phone, you select what you want. You're able to place orders on your phone right now. So there is no KOT or there is no waiter waiting for you to take the orders. Digitally, you are actually placing orders in the kitchen. People are serving food onto your table. So the hotel industry is moving into a less contact takeaways or F&B services. I'm sure my friend Brijesh would cover more of that aspect on the F&B side. Technology and awareness of technology, ability to adapt what right technology to where is becoming critical in today's hotel industry. While we believed IT was nothing much to do with hotels, I think we have to adapt to it. That's the new normal. All of us need to understand what technology works where, keep our eyes and ears open what's happening around, look at what the best of things that we can bring into technology at a value for money price. We cannot be bringing everything on board. Revenue, when I get back to revenue management, today dynamic pricing is the norm. There is no more a bar rate that you see in any of the hotels. You book a room now, maybe when you book a room in the afternoon, the rates would have changed, especially on online travel portals. This is driven by backend platforms called the channel manager, which actually distributes your price and inventory into these channels. And also there's a revenue management tool that is algorithm driven. So you are actually putting an algorithm to the system. System is predicting prices that need to be put up, similar to the hotel, to the flight ticketing that you see. Hotels have already moved in. I think that becomes more critical now in looking at dynamic pricing, depending on what the market demand and supply is available as of now. Few insights that I could share. I think with this, I end my gyan, let's put it that way, over to Abhijit. Thank you, Abhijit.
Yeah, thank you, Mr. Suraj. It was quite insightful and interesting to listen to the best practices being followed by you and your establishment, in fact. So, well, now, yes, sir.
I just want to talk, tell Mr. Suraj. I just want to talk to Mr. Suraj once. I want to just tell him, Mr. Suraj, can you hear me?
Yes, sir. Yeah, I would request to unmute Mr. Suraj so that he would be able to respond.
Yes, Rajesh, I can hear you. Go ahead.
Mr. Suraj, you asked one question whether the university runs the Bangalore University revenue management, right?
Right.
Yeah. So latestly, I would like to tell you that we have reframed the syllabus completely from Bangalore University, and we have kept revenue management as a big module of around 16 hours. So from this year onwards, we have taken it very seriously, and we have put the revenue management thing into it, so that we can really have justice for our students from coming semester and coming year. Thank you.
Excellent.
Well, okay. Going ahead from here. Now, I have in fact one more question for Mr. Suraj here. That as you were saying that every hotel has now jumped into the bandwagon of hygiene and sanitation, right? So so much so that the differentiators in the brand are being ignored. So how is your establishment or Sterling Resorts, holiday resorts, are tackling this kind of a problem, creating a differentiator? Like you have given some examples regarding the insurance.
Right.
So,
yeah, so one of the aspects we felt we need to stand aside during these times is, as I mentioned, insurance. Other things is largely looking at productization. We never got into products, right? We believed it is either room, you're selling a room. Creating products out of holidays or rooms is what is another driver, because when I get into something, if I'm getting a full board with multiple things thrown into it, makes a lot of difference to the buyer today. apart from what is normally a CP rate, which is always floated across most channels. So productization is the other differentiator, creating various products that people can purchase across various platforms, not just OTAs, being present in multiple platforms. And insurance, and of course the hygiene and sanitation. Just another aspect of hygiene and sanitation, what's happening today is when you go into any of the online travel portals, most of them are actually publicizing the hygiene sanitation, safety first kind of badges across all resorts or hotels, which is self-declared. Some of the OTAs, namely, okay, let me name them. They're Go Ibibo and Make My Trip has now come up with some of their identified safety norms. They're identifying one of the big fours to look at audits of the hotels and then give certification. So there is a standardization of the display of badges, so that only the certified hotels can display badges and not anybody else. That's the differentiator on an online travel agent portal that you will notice coming soon.
Okay, Mr. Suraj. In fact, this clarifies how you are especially trying to distinguish your brand from the rest. In fact, so now, okay, one more question I would like to ask you is that what are your expectations from the government of India, or what kind of support you require that would help you tackle this, the COVID issue and increase revenues for your hotel?
See, government is doing whatever best from their end. Okay, they have multiple industries to look at. Yes, we can always say we've not got a fair deal in the hospitality industry. Looking at various factors. Yes, few things that we really can look at from a government perspective is, one is ability to have clarity on travel. Even today, states have restrictions of travel. While I travel from one state to the other, there are quarantines that is required. There are e-passes that's required. Some of them now are getting into demanding of even asking for a COVID negative certification, which is valid only for 72 hours. So these are some of the roadblocks that's coming into a travel program. I mean, I think the average pricing of a COVID certificate is ranging between, I think, 3,000 to 6,000 rupees, depending on the hospital that you get. Imagine somebody having to get a COVID negative certificate to enjoy a holiday. That's not going to make sense to people. Minimum occupancy is going to be 2 or 3. That itself costs you around 12,000 rupees just to get your certificate for going and enjoying a 2-night or 3-night holiday anywhere. These are some things I'm sure government is also looking at it. There's a lot of relaxation coming in as days go by. Unlock 2 has brought in a lot of relaxation. As things come, I think we'll have more clarity, and the state of fluidity will become a little more clear and constant as we go by. Let's hope for the best and work together towards that.
Sure, absolutely, Mr. Suraj. In fact, what suggestions you have given would surely help other establishments also pick up the revenues better in this COVID environment. So now I would request Chef Brijesh Thakur to share his views on the topic impact of COVID-19 on the hospitality industry. I request Chef Brijesh.
Yeah, good evening, Mr. Abhijit. Can you hear me?
Yes, Chef, loud and clear. We are all able to hear you clearly, Chef.
Yeah, okay. Initially, I had some technical issues, but I think hope you can, I'm audible and you can hear me clearly.
Yes, Chef.
Okay. First of all, just would like to wish you all for this organizing this session. And as you know that I'm Brijesh Thakur working for Quality Hotel DB Manor, Vijayawada, Andhra Pradesh. This COVID-19 is going on for almost more than 3 months. And it is a matter of great concern for the lives as well as the livelihood of the people. You see, in the past 3 months, economy is very hardly hit, and all the sectors, I mean, across the globe, is very worstly affected. Now, coming to the hospitality, and I being the chef, I mean, coming to the business in the hotel and our work culture and all that, we have been severely impacted because the business have gone very down, and it is very difficult to manage in such scenario. Uh, there are a lot of initiatives that need to be taken because this COVID-19 is something which was not observed in the past so many years, maybe more than 100 years. No such scenario was in the light. Nobody knew about it, and it is an experience in itself. So, as you know that there is no cure and no vaccines available for this COVID-19. So, only the care and precautions that needs to be taken, and taking care of your immunity is the most important thing which one has to follow. Coming to the kitchen, basically we are also following a lot of precautions as led by the government. For example, working in a kitchen, we have to do the for the staff. We have to do the thermal scanning before anybody walks into the kitchen. In fact, thermal scanning is done at the security point only. If anybody is having fever and all that, he is not allowed. So once you come to the hotel, even in the kitchen before entrance, there is a thermal scanning so as to check whether employee is having any fever or not, and sending the employee back if there are fever or there are any visible symptoms like coughing, sneezing, or anything of that sort. So thermal scanning is very important. Moreover, we are insisting on wearing masks, which are very essential. It is the new normal as of today's date. So wearing masks is very essential. And apart from normal, I mean, in kitchen, like chef caps and aprons, those are essential. Otherwise, also pre-COVID time, also it was an essential thing. And now the mask has come, and wearing gloves when you are handling the food and any food item. So you have to wear the gloves. So those are things which are very stringently followed, basically, very strictly followed. And hello, am I audible?
Yes, you are audible. Loud and
Okay, fine, okay. So, so these things have become a new normal, basically wearing masks, and there are other and personal hygiene and sanitation which needs to be taken care of. When it comes to the level of the people who are working in the commercial kitchens like hotels, restaurants, uh, the few basic things which needs to be explained to them on a daily and regular basis about social distancing, which is very important because as we know that there is no cure. So the new thing is it's earlier it was like we have to defeat corona. Definitely we have to defeat corona, but at the same time now it is like there has been no cure and no prevention up till now. So we have to live with the corona. So what we have to do to survive, because corona is not going and we have to survive. So the precautions or preventive measures include social distancing. This is one very important aspect. Social distancing. Uh, Minimum there should be a 2 meter. That means around 6 feet gap should be there between two persons. That has to be maintained on a very strict basis. And wearing mask is very essential. And now coming to the kitchen, basically in kitchen also, because of this COVID problem, the staff strength has been reduced to almost 30% compared to pre-COVID times because of the social distancing issue is one thing, the reason for reducing the staff strength, and second is as the business is hit hard, you all know. So in that case also it is not feasible to maintain the pre-COVID staff strength. So it has been reduced to almost 30%. So social distancing norm has to be implemented very strictly. Staff needs to be educated for personal hygiene. That they have to wash their hands frequently with alcohol-based sanitizer. If alcohol-based sanitizer is not available handy, they should also make use of soap and water. They should rub their hands thoroughly for 20 seconds with soap and water. This needs to be repeated every how frequently they are involved in the work, touching the different surfaces and all that. They should do it as frequent as possible. Otherwise, also once every 2 hours, one should sanitize his hands with alcohol-based sanitizer. When it comes to educating the staff, it is very essential to educate them because this practice was not before pre-COVID. So using alcohol-based sanitizer, you need to train your staff that when they are using it, how much they should use it. So basically, it's very simple size of a coin. You just put it on your palm and rub it in such a way so that you cover both the inside and outside of your palm. Uh, you need not smell it immediately after implementing alcohol-based sanitizer. You should not try to inhale it and all that because it can be toxic. It can. It can create, if you touch your hands, face, or any part of your mouth, then it may can cause irritation. So you should not try to smell it. Should not touch it. It is basically only for your hands, and that is very essential that using alcohol-based sanitizer and keeping these things handy, very easily accessible for the staff. In the work area, you need to keep these alcohol-based sanitizer. At the same time, one important aspect is you need to educate them because as it is alcohol-based, they should not go very close to the, immediately they should not go to the cooking range and all that. They should wait for 10-15 minutes because it automatically evaporates. So this minimum basic things that needs to be trained almost on a daily basis. It needs to be supervised. Whether the staff is somebody needs to supervise it, whether it is implemented religiously, and there should not be any leniency as far as washing hands is concerned, wearing mask is concerned, wearing personal protective equipment in case of chefs, like wearing caps and their proper chef coat and aprons and wearing shoes. That is very essential. Uh, when it comes to kitchen, otherwise also before pre-COVID situation, normally hotels they take a lot of care of their sanitization. So that also needs to be. It will be now in a more stringent way, like sanitizing your floors, your equipment, utensils. Basically, the places which are more in contact with the individuals, like door handles, any knob or handle of an equipment, which are very frequently touched, that needs to be sanitized with disinfectants, and it needs to be monitored whether these things are implemented and strictly followed or not. If you observe that any of your employees having respiratory systems like coughing, sneezing, you should immediately ask him to. You have to make sure that he leaves the kitchen and he goes back home, and should consult health department and get proper medication. Nobody who is having any mild fever, any symptoms of cold, cough, sneezing, any flu-like symptoms, headache, uh, any sort of breath shortness, breathing problems, he should not be allowed. That has to be monitored at the entrance point only. When somebody is entering into the kitchen only, it needs to be monitored. And it is all about social distancing and wearing mask. And in case if somebody is coughing and sneezing and he's not wearing mask due to some reason and all that, so there is a very simple this thing that one should fold his arm and should try to cover his mouth and nose so that it should not the droplets and all should not pass on to the person who is standing nearby. And if he is using the tissue, then it must be immediately disposed of. And again, the hands needs to be sanitized well. So these things are very essential. Uh, Now, as we are having this thing for the past 2-3 months, and especially like in hotels, in my hotel also, we have quarantine rooms. So we are ensuring that all these systems needs to be followed very strictly, and we are also restricting food handlers also. They are bare minimum. Not too many people are handling the food stuff. Like we had quarantine rooms, so dispensing their meals, breakfast, lunch, and dinner. We are doing it in a packed manner, and cutting down on guest interaction. Basically, all communication to the with the guest is through telecommunication only, through phones only, or mobile phones only. And food is also kept in the tray. And while delivering to the room, minimum 1 meter distance is followed, and there is no touching with the hand. It is kept on the tray, and guests will pick it up. So all these things needs to be taken care of, because there is no cure, there is no vaccine, and everything is very uncertain. So we have to abide by the rules and regulations of the local health authorities. We have to be in touch with them, and we have to follow the guidelines. Um,
Okay,
these
sir.
things,
Okay.
yeah,
So, in fact, here I wanted to ask one thing that
yeah.
how have you redesigned your menu or updated your menu, as per for the COVID?
Yes, Mr. Abhijit. Since the quarantine, since this COVID-19 problem is almost 3 months, so immediately in the first 1 or 2 weeks only, we immediately curtailed our menu. Now, this very important thing which needs to be noted is we cannot. This is a COVID thing, and how we were our menus were very elaborate, very exhaustive before pre COVID-19. There used to be, when it comes to star category hotels and all that, there used to be a, like, showcasing the skills. Creativity was of far importance. So that is how star hotels are different from regular eateries. So we used to exhibit our culinary expertise. But now it is in the COVID situation, it is like restricting our menu to the bare minimum. So menus, we have redrafted our menu. We have kept a very compact menu, and moreover, we are not running with our regular menu cards. We have also come up with our disposable menu cards. So, like, as we have, as per the government norms, we have opened our coffee shop, which is with 50% capacity, considering the social distancing. We have relayed our outlet so that the rule of 6 feet distancing, social distancing, can be implemented. And now we have kept it to as low as 50%, 40% capacity we are operating. And we are and we have trained our staff to hand over only the disposable menus, so that we can minimize the contact with the menu card and the spread of the disease. There are two things. One is you have to protect yourself by following proper hygiene and sanitation. At the same time, you have to ensure that because of your any action or anything, it should not get transferred to other persons. So you are equally responsible for the society. So we have come out with this disposable menu cards, so that it should not pass into from one hand to another. Once the guest goes through it, he can immediately dispose it off. And disinfecting the tables before the guest is being seated. After the guest leaves, again the tables are being disinfected. So, and regular announcements are being done to make sure that people wear masks and all that. Uh, Educating the people to have communication with the guests with proper distancing and all that.
Okay, okay.
Yes, yes.
So, okay, one more thing, Shiv, which I wanted to ask was like a lot of restaurants are using like QR code for menu.
Yeah.
Like so. Have you adopted that practice, or like Mr. Suraj was saying that disposable crockery and cutlery for for the
Yes, yeah,
restaurant?
yes. Because after this lockdown things, after 2 weeks or three, after almost around a month, I mean, when we got the instructions from our local authorities that we need to cater to some quarantine people, uh, uh, we initiated quarantine facilities, and we need to cater to the quarantine guests. So what we are following is in the rooms, we are not using any regular crockery and cutlery. We are using only disposables. So everything is packed, and the food also has been drafted in coordination with the health authorities as per the guidelines, which are to be provided to the guests. So in aspects of health, nutrition, we are taking due care so that we should provide them the healthy and the best food in disposable packings only, and no proper regular cutlery and crockery is being used, because there is no question of getting that thing back to the kitchen and how it was done in pre-COVID time. It is about uh, having it from the disposables, and then there is also disposable garbage bag which is handed over to the guest along with the packed food, so that after his meal is over, he can just self-help, he can just put it in the garbage. There is a string attached to that garbage bag so that it can be tightened, it should not really loose. And these things are communicated to the guests through phones only. Uh, we are communicating it. We are communicating it at the reception at the time of check-in. We are communicating it through our room service point. We are educating the guests so that the soil and all everything should be put in the placed in the garbage, and the string needs to be tightened. And thereafter the clearance is done, and it is straightway taken to the garbage disposable site without, having any entry into the hotel.
Okay, okay, chef. So in
Yeah.
fact, it was pretty evident that you were following all the guidelines also and best
Yeah,
practices.
yeah. In coordination with the local health authorities, we are following their directives basically.
So what advice would you give for the upcoming hotels or persons who are entering into the hospitality business post COVID era?
Mr. Abhijit, this is a very strategic question you have asked me, because we are still in the middle of the. I don't know whether I can say that we are in the middle of the ocean. We are still far away from the ocean. I do not know, because it's all. If you look at it, it is COVID-19. It's clearly that it is the disease which has come up in the year 2019 in European countries. Taking the examples of Italy and France, Spain, from November itself, the cases were noticed, and through WHO and all that, the world came to know about it in the month of January. And by the time in India, the first lockdown was initiated in the month of March, in the third week of March. So, I mean, and up till now, there has been no cure basically, as if vaccine has its own stringent policies. Coming out with a vaccine, it's a time consuming process. After coming out with a vaccine, there are a lot of trials and all that. So that, Council of Medical Association, they must be more, aware of it, that how much time will it take. In the near of thing, I'm not seeing any vaccines coming out, and the cases have not subsided. Still, there is a surge. So it is a long way. Let's hope that we come out with this solution as early as possible for the mankind. But the fact is, we are still not sure how long will it take. But still, let's hope that this problem gets sorted out soon, in near
Sure,
future
sure.
soon and all that. Post COVID, there has to be a total infrastructural change, Mr. Abhijit. There has to be a drastic change. It will be all new norms which will be led. Whatever has been followed pre-COVID-19, it is going to be a total all over in the process. Basically, the people in the hospitality business, they have to rethink. God forbid, just in case if such type of pandemic bounces back. Uh, so in that case, the travel industry will be almost collapsed basically, and it's bare necessity of just having food and all that. So survival of the hospitality itself is a big question mark basically, and then there is it's just like, you can have just a where there will be no question, or if there is no travel, there is no demand for hospitality, there will be no requirement for rooms. In that case, it will be just the commercial kitchens which will be running. So
Okay.
it is going to be a total overhauling in the infrastructure. Total layout needs to be changed because up till now the kitchens were made so that efficient use of the space can be done and all that. But in future, you have to take care of the proper inflow, work flow of the kitchen, and social distancing norms, and minimal touching with the hands. So technology will come into scene. So there will be more of new technologies which will come into the scene. So it's going to be a total infrastructure change.
Right, chef.
Yeah.
Okay, right. Very relevant points, and some things. I understand the difficulties which we are facing in the existing infrastructure, and very relevant at what we have to come up with next. So, well, thank you, Chef Brijesh. In fact, it was informative listening to you, and on field, on ground, we have learned what the measures have been implemented. Now, I would request Chef Subin, who is our guest speaker, to join us and share his views on the topic. And first of all, Chef Subin, thank you so much for joining us and accepting our invitation to speak on the topic on a very short notice. Thank you so much, Chef. And
Okay,
over
thank
to
you,
you,
thank you.
Chef Subin.
Yeah, good evening all. Can you hear my voice?
Yes, Chef.
Yes,
Loud
yes.
and clear.
Okay. Actually, I am a 2008 pass out student in AMC College. The Rajesh Kumar sir is giving this opportunity. Thank you, Rajesh Kumar sir, first of all. Then, can you hear?
Yes, Chef. We are able to hear you.
Okay, actually the Bridges chef has told the almost the what the protocol we are following inside the kitchen, what the process we are doing inside the kitchen, everything the Bridges already told. The one more thing, we are our menu before what we are giving in our hotel. This time the post of COVID-19 situation, we reduce our menu in 50%. Why? Our manning also we are reduced. That's why the limited item only we are serving in the hotel. That also we are, why we can't put all the staffs in our kitchen. Why? The social distancing, mask, sanitizer, sanitizing, every protocol we need to follow. That's why we are giving only limited menu only we are giving for the guest. The menu also we are giving, that is also which chef told. The menu also we are giving at a limited, not limited, the disposable type menu only we are giving for the guest. Means we are, before we are, what we are giving in a permanent menu, this time we are giving a disposable menu. It's only 50% only. 50% means this menu is a disposable menu. Once one guest is use this menu, then we are dispose this menu. Then we are giving, I am working with Accor hotels right now. We are giving the food and all, we are giving only the disposable plates and disposable knife and disposable fork. The government norms and government protocol also we are following. They told 50% seating capacity only allow inside the restaurant. That's why we are following the 50% guest only we are allowing in the hotel,
Okay, Chef.
restaurant. Then the disposable type, whatever the disposable types we are using, one more things we need to check. This is we need to check this is eco-friendly item. We do not buy the plastic and all the things. We are using the disposable plates. This eco-friendly, biodegradable, eco-friendly item only we are using. We are also doing the quarantine business also. Nowadays, last one more month, we are doing the quarantine business. Quarantine business means the shipping quarantine business we are doing. Shipping
Okay.
quarantine business we are doing the last 1.5 months. Last 1.5 months we are doing the shipping quarantine. The every room we can't, the government has told the 50% norm, 50% guests can allow inside the restaurant. But we can't allow we have 115 rooms, but the 115 rooms guests are coming for having lunch or dinner or breakfast. They are coming at a one time, but we can't control the timing. That's why we are serving the mostly we are serving the food only in room dining only. We are serving the government norms and protocol we are following.
Right, chef.
All the things that Bijesh has already mentioned, but again, one more thing, I'm repeating this. Then I want to tell you one more things. The hotel, we are giving the training, the COVID-19 situation, how we can handle this guest, what is the protocol we are following, what is the norms is there, what is the strategies, everything we are giving the training. The online wise training or room wise training, both are we are giving. But I want to tell you one more thing. The colleges everywhere, the students are studying there. At least the basic training everywhere we need to give. Everywhere, every place. The colleges also, all over the people are wearing mask, glove, everything. But they don't know how to wear the mask, how to remove the gloves. The most of the people don't know how to wear the mask and how to remove the gloves. They are simply removing the glove and simply removing the mask. The norms, what we are following for a protection, we are not following for the correct way. This is return it will come for our health. That's why we need to follow the proper this thing.
Understood, chef. Understood.
Then
What I want to say is that, chef, the proper guidelines have to be followed while wearing the mask and following the hygiene sanitation features, right? So absolutely clear, chef.
Yes.
In fact, it has been great that you have accepted our invitation to join. And, so at Accor Hotels, where you are working as an executive chef at present. So what
Yes.
is the distinguishing thing which you have done, sir, chef, for safety of guests? We would request a very short comment as we are running out of time. So a last thing on how you differentiate in the Accor Hotels, chef.
Can you repeat again? Can you repeat? Voice is breaking, sir.
Okay, so what I will do is, since the voice is breaking here and we are also running out of time for this session, so I will like to just go ahead and close the session now, right, chef?
Okay.
Right, chef. It has been a pleasure to organize this webinar and an honor also. And I hope each and every participant have enjoyed watching the webinar as much as we have, enjoyed. We as the Department of Hotel Management have enjoyed conducting. So, we'll be organizing our next webinar on 9th of July, that is on Thursday at 11 a.m. on the topic COVID-19 and imposed paradigm shift in the tourism and aviation industry. So, Mr. Gladson George, Sales Manager, Air China in Dubai, will be joining us, along with Mr. Praveen George, General Manager, Operations and Sales at Atkins Spence Hotels and Resorts in Middle East. They will be joining us for the next session on 9th. So it was in fact an extremely learning session for us, informative session where Mr. Suraj has told us about the best practices being used in his hotel with mini buffet, in-room dining, disposable crockery and cutlery, insurance being offered for the guests, and clubbing travel for people, providing mini meals, and similar best practices
Yeah,
followed by hotels, along with comments from Chef Brijesh, who has told about
yeah,
how
yeah.
hygiene.
I
Yes, chef. Along with the hygiene and the
yeah,
sanitation features told by Chef Brijesh. Also, Chef Subin has added that of the features being followed in his hotel, Accor Hotel, on the ground hygiene and sanitation features which are being followed to make the stay of guests safe and secure. The main thing which people are worried is fear of traveling, fear of going to different places so that they do not get the virus or they do not get affected by COVID-19. So you have explained how you are making the guests feel safe, and also so that people travel more and more and we come back to normal, and situations turn like pre-COVID we were living earlier. So finally, what I thank all the people attending the webinar, and also those who are attending will receive a link of feedback form. And once you fill by day end today, and once you fill up the form and submit it, you will receive your e-certificates by tomorrow. We look forward to your presence on the webinar on 9th, and I would first now like to thank the management of AMC College for guiding us, training us, and making us better academicians, and giving us opportunity to conduct this webinar. Our principal, Dr. DVSSR Prakash, for his constant guidance and motivation. Our panelists, Mr. Suraj, Chef Brijesh, Chef Shubin, for accepting our invitation and taking time out from their busy schedules for this webinar. I thank our director, Professor Rajesh Kumar, for guiding us constantly, and all the staff members of AMC College for joining in on the webinar. A special thanks to Mr. Ranjan for coordinating with the Zoom application and helping us with all the IT infrastructure, without which this webinar would have been incomplete. Thank you so much. And last but not the least, I thank all the participants of this webinar for taking time out to attend and listen to us. Until we meet again, please take care and stay safe. Goodbye, friends.
thank you, thank you, thank you.